Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the antiarrhythmic drugs. Antiarrhythmic drugs are used to manage the patient with arrhythmia. In the heart, we have conducting system of the systems that include SA node, AV bundle, left and right branch, and Purkinje fiber. The purpose of the conducting system of the heart is to generate action potential and its propagation throughout the heart cardiac muscles. So we'll start the classification. We have the class 1 sodium channel blocker, and that slows phase 0 depolarization, causes a decreased excitability and conduction velocity. 1A, slow the rate of rise of action potential, slows conduction, prolong the action potential, and increase the ventricular effective refractory period. 1A include procainamide, disopyramide, and quinidine. 1B, it decreases the duration of the action potential by shortening repolarization. Example is lidocaine and mexiditine. Okay. Classification of antiarrhythmic drug were continued. Therapeutic uses of class 1A drug, very commonly used. Previously, the therapeutic use is the quinidine. Wide variety of arrhythmia including atrial, AV junctional, and ventricular tachyarrhythmia to maintain sinus rhythm after direct cardioversion of atrial flutter or fibrillation, to prevent frequent ventricular tachycardia. Adverse effects of quinidine, and that adverse effect may be exacerbated due to lack of blood level of potassium. That adverse effect is manifested as exacerbation of the arrhythmia, heart block, and assisted ventricular tachycardia, nausea, vomiting, and diarrhea. Large doses include synchronism because quinidine is close to quinine, and these are derived from cinchona. The manifestation of synchronism is blurred vision, tinnitus, headache, disorientation, and psychosis. Mild anti-adrenergic and anticholinergic actions are also included as adverse effect. Drug interaction with digoxin and phenytoin. Digoxin is used to maintain heart force of contraction, and phenytoin is an anti-epileptic drug, anticonvulsant drug. So these two drugs may interact with that of the quinidine. This is the conducting system of the heart. Is the SA node, AV bundle, and the left branch and the right branch of the AV bundle. Okay, so this is the left branch, this is the right branch of AV bundle, and this is the Purkinje fiber on the left ventricle, Purkinje fiber on the right ventricle, and we are looking at the action potential, upstroke 0, early fast repolarization 1, 2 is the plateau, number 3 is the repolarization, and number 4 diastole. Just we'll compare with that of the EKG, that is a PQRST, P for atrial part, QRS for the ventricular contraction, and this T is going through the repolarization. So disopyramide is one of the 1A group. Adverse effects include anticholinergic activity that is manifested by dry mouth, urinary retention, blurred vision, and constipation. Disopyramide is contraindicated in heart failure. Class 1B drugs rapidly associate and dissociate from sodium channels, but weak effect on phase 0 ventricular depolarization, The drug acts when cardiac cell is depolarized or firing rapidly, particularly useful in treating ventricular arrhythmias. Adverse effects of lidocaine. The class B drug, we have three commonly used drugs: lidocaine, mexiletine, and tokenamide. The adverse effects of lidocaine include drowsiness, confusion, slurred speech, agitation, convulsion, and rarely cardiac arrhythmia. Mexiletine used for chronic treatment of ventricular arrhythmias associated with previous myocardial infarction. Adverse effects include nausea and vomiting. Tokenamide used for ventricular tachyarrhythmia. Adverse effects of tokenamide include pulmonary fibrosis. Class 1C drug. This is a powerful fast sodium channel blocker which depresses phase 0 upstroke in Purkinje and myocardial fiber with limited action on repolarization and refractory period. Class 1C drugs include flecainide and propafenone. Therapeutic uses of Class 1C refractory ventricular arrhythmias, particularly useful in suppressing premature ventricular contraction. They are considered to be broad-spectrum antiarrhythmic drugs. The Class IC drug. These are the flecainide and propafenone. Adverse effects include dizziness, nausea, blurred vision, headache, aggravates pre-existing arrhythmias. There may be life-threatening tachycardia. Okay, 1C drug markedly depress the rate of rise of membrane action potential, cause marked conduction slowing, and slowly binds to sodium channel. And we have just discussed it has two members, flecainide and procainamide. Class 2 antiarrhythmic drug. These are beta blocker, include propranolol, metoprolol, ismonol. This is non-selective beta blocker. Mode of action. These are the selective beta blocker. Mode of action diminishes phase 4 depolarization, depressing automaticity, prolonged AV conduction. AV means atrioventricular conduction, decreases heart rate contractility. Therapeutic application: tachyarrhythmia caused by increased sympathetic activity, atrial flutter, atrial fibrillation, and AV nodal reentrant tachycardia. Adverse effects of propranolol: bronchoconstriction. So it should not be given to patient with bronchial asthma or emphysema. Advantages of metoprolol: less risk of bronchoconstriction. Advantages of ismonol: very short-acting beta blocker used for intravenous administration. There is the ismonol. Class 3 antiarrhythmic drug. These are potassium channel blocker and diminish the outward potassium current during repolarization of cardiac cell. They prolong the duration of action potential without altering phase 0 of or the resting membrane potential depolarization. They prolong the duration of action potential. Class 3 antiarrhythmic drugs include amiodarone, sotalol, and dofetilide. Adverse effects include interstitial pulmonary fibrosis, hyper and hypothyroidism, liver toxicity. These are the adverse effects of the amiodarone: interstitial pulmonary fibrosis, hyper and hypothyroidism, liver toxicity, photosensitivity, tremor and ataxia. Okay, tremor and ataxia. Okay, neuropathy, muscle weakness, blue coloration of the skin. Class 4 antiarrhythmic drug, this is a calcium channel blocker, decrease the inward current carried by calcium, resulting in decreased rate of phase 4 spontaneous depolarization, slows conduction through the AV node. Class 4 antiarrhythmic drugs include verapamil and diltiazem. Therapeutic uses include reentrant supraventricular tachycardia and in decreasing the ventricular rate in atrial flutter and fibrillation, also used to treat hypertension and angina. Adverse effects have negative inotropic properties, so it is contraindicated to depressed heart function, vasodilatation, and hypotension. Okay, we got class 3, we got class 4. So class 3 is potassium channel blocker, and we have the drug like amiodarone, sotalol, and dofetilide. And class 4 is the calcium channel blocker. Our drug is these are the calcium channel blocker. Okay, so they are used to manage reentrant supraventricular tachycardia and decreasing ventricular rate in atrial flutter and fibrillation, also used to treat hypertension and angina. Drug include the verapamil and diltiazem. These drugs are under class 4 antiarrhythmic drug. Adverse effects, negative inotropic properties, contraindicated in depressed heart rate, heart function, because this mode of action is to inotropic properties, negative inotropic properties. So if a person has already depressed heart failure, then this is not the drug for that person. Vasodilatation and hypotension. Other antiarrhythmic drug like digoxin that decreases the refractory period in atrial and ventricular myocardium, prolongs the refractory period and diminishes conduction velocity in the Purkinje fiber. Purkinje fibers are located in the muscle of the left ventricle and right ventricle. Adenosine, okay, adverse effect of digoxin, we got that. Control, digoxin, it controls ventricular response rate in atrial fibrillation flutter. Adverse effect of digoxin include it in toxic dose it may cause ectopic ventricular beats, ventricular tachycardia and fibrillation. It is treated with lidocaine as an antidote at that time. Adenosine decreases conduction velocity, prolongs refractory period, and decreases automaticity in AV node. Has an extremely short duration action, only 15 seconds, intravenous application for supraventricular tachycardia. So that may be used, we can use adenosine. Magnesium is also an antiarrhythmic drug, but it was first discovered that it worked very good in a patient who has taken digitalis, but eventually found it may work even in a patient without digitalis induction. So used in digitalis induced arrhythmias and in torsion de pointes. This is a type of cardiac arrhythmia involving the ventricles. Okay, highlights: classification of antiarrhythmic drug, mode of action of each drug, therapeutic application of each drug, adverse effect of quinidine, amiodarone, and digoxin, appropriate antiarrhythmic drug after a mitral infarction, what is that, how a reentrant arrhythmia occurs, beta blocker, advantages of metoprolol and esmolol. Advantage, they are selective beta blocker, so they may not block the respiratory system. So it is good for a patient who has also asthma. Okay, and that's all about the pharmacology of antiarrhythmic drug. You have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.